Hi, my name is Abeeha Naqvi. I'm a first-year fellow at Creighton University from Phoenix, Arizona.
Hey there, my name is Billal Mohmand, and I'm a first-year fellow at University of Arizona, Phoenix.
And we are here today with Dr. Jonathan Afilalo talking about his late trial called PERFORM-TAVR. And thank you for joining us today.
Thanks, nice to be here.
And if you could tell us a little bit more about PERFORM-TAVR.
Sure. Well, PERFORM-TAVR was a clinical trial that took place between 2019 and 2022. The rationale for the trial was that we saw a good proportion of patients, actually 40% of patients, having successful TAVR procedures, but then reporting poor quality of life, poor functional status 1 year later. And we attributed that in our prior research in great part to their frailty. So why not treat the frailty in parallel with the heart and improve their outcomes so they can benefit from their TAVR? That was the rationale. And the way we did that was through exercise and protein supplementation to treat their physical frailty, get them stronger, get them more mobile. And at the end of our intervention, we had a primary outcome at 12 weeks, which was based on the Short Physical Performance Battery Score, SPPB. And we achieved a clinically meaningful, substantial change of 1 point in that SPPB at the end of 12 weeks to give these patients better strength, mobility, and balance, and allow them to benefit from their new heart valve.
Excellent, that's great. Just a question on that. How did we select elderly patients that were frail? What frailty cutoff did we use?
Right. So we screened patients in the TAVR clinic, and anyone who was 70 years of age or older and had objective evidence of frailty was eligible. For the purpose of this trial, we used the SPPB of 8 or less. And midway through the trial, the pandemic hit. So we added the SF-36 physical functioning subscale less than or equal to 55 to be able to screen patients remotely and include them in the trial in that way.
As for the exercise program, how did that go about with the patients?
Yeah, so the exercise program was home-based, and it was based on the WEB protocol, where a trained therapist would visit the patients twice a week for 1 hour in their home and perform simple exercises such as standing from a chair repeatedly, such as balancing on one foot, such as on off days walking. We measured that with a wrist-worn accelerometer to make sure patients were also doing an unsupervised component, mainly around aerobic. But really, it was things that were feasible in the patient's homes and assisted by a therapist who would make them easier or harder depending on the patient's capabilities. So very much adapted, which is needed in this patient population. As you know, they're so heterogeneous that it's not one size fits all.
Definitely. And then for protein supplementation, how did that differ from your typical recommendations and diets?
So, the older adult, especially undergoing a catabolic stress, we'd like them to have 1.2 grams per kilo per day of protein at least, if not 1.6. So the idea was to give them as much as possible in the form of a beverage that contained 20 grams of protein. We did that twice per day. And we did that for 4 weeks before TAVR, up to 12 weeks after TAVR, to get them approximately 40 extra grams per day of protein. And we tried to emphasize not to do this instead of meals, but rather as a supplement after meals or with exercise.
Fantastic.
Great, thank you. And the general results of what we found?
Yeah, so the general results were positive. At 12 weeks, as I mentioned, we saw a 1 point improvement in the SPPB. For reference, a 0.5 point is a meaningful change. A 1 point is a substantial meaningful change. And what does that equate to? Because a lot of people may not be familiar with the SPPB. A 1 point change in SPPB is equivalent to going from a lot of difficulty walking 1 block to no difficulty. It's also equivalent to improving your 6-minute walk distance by 36 to 52 meters. And finally, it's the same effect size and same actually primary outcome as observed with traditional cardiac rehab, such as in the Rehab HF trial.
Great, that's fantastic. Thank you for joining us, everyone. And I thank Dr. Jonathan Afilalo again for being here and telling us about his results. To watch more videos like this, please check out youtube.com, FITsOnTheGo, and follow us on Twitter at FITsOnTheGo.